John Paul, I get to introduce our speaker today. So Dr. Nicole Haughton was born on the beautiful island of Jamaica. She graduated from Oakwood University in Huntsville, Alabama, where she majored in biology and Spanish. She completed her medical education in Ohio and her residency training in California before moving back to Huntsville, Alabama. She enjoys reading, watching cooking shows, and exploring the art of dreaming big. To date, she is the only doctor in her family. And so without further ado, I introduce Dr. Nicole Haughton.
Hi, everyone. I'm Dr. Haughton, like John Paul said, and I'll be giving a quick presentation this afternoon on what I do, which is pediatrics. And then feel free to ask any questions. How can they ask questions? Can they type them to you guys or?
Yeah, if they type in the chat, then we can read them out, or we can just say unmute. So if you have a question, just put it in the chat or just say you'd like to ask a question.
All right, let's go ahead and get started. Let's see. All right, so obviously I'm a pediatrician, which is one of the fields in medicine, but medicine is and just healthcare in general is a very vast field. So before I get into specifically what it is that I do, I just wanted to talk a little bit about healthcare in general. So why healthcare? There's so many good reasons to join the healthcare field, but one of them is that healthcare has tons and tons of options, right? Just on this graphic alone, you see nurse practitioner, home health aide, occupational therapist, physical therapist, or physician assistant. And those are just a handful of the different things that a person can do in healthcare. There's dentistry, optometry, quite a few different fields that you could go into while still being in healthcare. So one benefit is that there are tons and tons of options. Then another good thing about healthcare is job security, right? Healthcare is one of the most stable industries to work in. There'll always be a need for healthcare, always be a need for healthcare professionals as our nation ages, and as people age, they tend to get sick. And so there will always be a need for people to take care of them in the many different roles that encompass healthcare. Then there's also growth. Employment is projected to add, healthcare employment is projected to add about 15% between 2019 and 2029. So when you look at different industries that are, work industries that are available, healthcare will always be one of the ones that's in high demand. You'll never not be able to find a job in healthcare. So job security is one of the benefits. And then I think the most important part of healthcare is that it's rewarding. You really get an opportunity to serve families and people at a time where they are very vulnerable. I don't know if any of you have been sick or have had family members that have been sick, but it really is a challenging time. And so the people that you come in contact with were able to help you in various capacities, whether or not that's the person who's checking you into the emergency room or the doctor that's actually seeing you or the nurse that's taking care of you. Having that opportunity to be of service in that capacity is very rewarding. And then outside of those three reasons, there's so many others. Healthcare is very diverse. From that graphic, you see you get to work with tons of different kinds of people, all races, all ages, all walks of life. Healthcare is also diverse and flexible in terms of you can work during the day, you can work during the night. Some people are night people. I'm a night person, which I'll talk about in a little bit. So there's opportunities both to work during the day and to work during the night. There's opportunities for introverts, there's opportunities for extroverts, and then again, you have the exposure to some exciting and new experiences. Like every day in healthcare, you are learning something new, you're exposed to something new. And so those are some of the other reasons why it is a wonderful career to go into. All right, so it was all a dream. So how did I get here to this place where I, like John Paul said, am a pediatrician and I'm the only pediatrician in my family. Like he said, this is where I was born. I was born in Jamaica, lived there until I was about 13 years old. And then our family moved to the United States. And when most people think about Jamaica, you think about the beaches and the beautiful scenery, but that's not necessarily where most Jamaicans live. This is kind of where I grew up. somewhere very similar to this. This is actually a picture of the school I went to, St. Jago Prep School. I went there from kindergarten until 6th grade. Our home, this is not my home, but our home was very similar to that one. And this graphic of just, some island kids playing is very similar to how I grew up. Most of the times when you see somebody who is a physician or who may be successful in any field, you tend to think that is how life has always been for them, but that isn't necessarily my story. I came from a very humble beginning, and I'm thankful for the opportunity to now be able to do the one thing I've wanted to do my entire life. This is how it started. That's me at 4, and this is how it's going. And it was about this age, when I was about 4 years old, that I decided that I wanted to be a pediatrician. And from that time on, I kind of mentioned that to my mom. She tells the story. I was on the steps. She asked what I wanted to do. That's what I said I wanted to do at about 4. And since then, have not really changed my mind. And thankfully, I get to do, like I said, the one job I've been wanting to do for my entire life. Now, I understand that not everybody gets a chance to do that. But like that graphic, it all started with a dream of this 4-year-old girl who wanted to be a doctor. Now she's a little bit older and she gets to actually do that. So why pediatrics? So I've always wanted to be a pediatrician, even as early as a child. I knew I wanted to take care of children in some capacity. And I think as I got older, for me, it was just the opportunity to watch kids grow. I don't have any children of my own. Most of the time when I see patients, parents will ask me, do I have kids? And I'm like, no, just yours. So that they're the children, my patients are the children that I don't get the opportunity to have. Then I also wanted to have a lasting impact. Sometimes when you see adults, while you do have the opportunity to take care of them over a long-term period, I, for whatever reason, was drawn particularly to children. I felt that it would give me an opportunity to not only take care of them physically, but also kind of shape and mold them emotionally, kind of serve as a mentor, especially as a Black woman. That was something that was important to me to be able to do. And children are fun, they're resilient, they're a little bit, for me, more fun to work with than adults. I think I learned pretty early that I did not necessarily want to work with adult patients. Some of the challenges and just health issues, I just wasn't as drawn to as I was drawn to taking care of pediatric patients. So how did I get here? Like, again, I showed you that picture of kind of where I'm from and how I grew up. I had no mentors necessarily at that age. There are no family members in my family that are physicians, but I always did well in school. And once I started to say that that's what I wanted to do, people started to encourage me. So my family supported me quite a bit and did not really allow me to deviate from what I said I wanted to do. Then I read a lot. I was always a pretty voracious reader growing up. Would always be staying up late to read and staying up past my bedtime to read. And part of what I read were books about doctors. Once I said I wanted to be a physician, people then started buying me books written by physicians, and just being able to read their journey and see how they got to where I felt I wanted to be was very helpful and supportive to me on my journey. And then the other thing, I just kind of stayed focused. I knew that this is what I wanted to do. I wasn't exactly sure how to get there at the time, but I knew that doing well in school and staying focused would be one way that I could eventually get to the place where I wanted to be. So pathway to medicine. So you guys are high school seniors or close to seniors, I believe. I knew that if I wanted to go to medical school, if I wanted to become a doctor, I would have to first go to college. And so I did that. Like John Paul said, I went to Oakwood University, which is here in Huntsville, Alabama. And that was 5 years because I was a double major in biology and Spanish. I've always loved Spanish. My sister was one of the first people who taught me Spanish. She was older than I was. And I was kind of intrigued by the language and I thought it was fun. So once I got to college, I knew I wanted to be able to study abroad. And the only way to do that was to be a Spanish major. And so I became a Spanish major for that reason. And then I knew I wanted to go to medical school. And at the time, I thought that meant I had to be a biology major. So I double majored in biology and Spanish. And so doing those two things added an extra year to my college experience. I was able to actually live in Spain for a year, which to date is still probably one of the best experiences of my life. Made a lot of good friends there and learned Spanish, which is the purpose of going, which is something I get to use every day. And I appreciate taking that extra year because now I'm able to communicate with a large population of my and kind of provide them with a different experience. Like once I walk into a room, firstly, most people don't expect me to speak Spanish as well as I do. But once I walk into a room and I'm able to navigate and talk to a parent about what's going on with their child in a language they understand, they automatically feel more comfortable. You just kind of see the worry melt off of them because they feel like they're being understood and that they understand what is happening. They're able to ask the questions they need to ask with regard to what's going on with their child. So college was 5 years. Then in order to go from college to medical school, I had to take the MCAT. Along the journey to medicine or to healthcare in general, there are going to be some hurdles, or not hurdles, but definitely things in your way that you have to go through past, doors that you have to go through. And one of them is the MCAT, which is a test that you would have to take before you get into medical school or before you apply to medical school. So I did that test, graduated from Oakwood University, and then went to medical school in Ohio. That was 4 years. And so during that 4-year process of medical school, during the first year, you learn about how the body functions when it's well. So you learn about anatomy, you learn physiology. That's where you dissect cadavers and kind of actually see what inside of a body looks like, so you can understand it when you're taking care of your patients. Then during the second year, you learn about how the body works when it's not well. That's where you learn about pathophysiology and the different ways that illness arrives in the body and then how to treat it. But there's another hurdle before you can go on to the next stage, and that's your USMLE board exam, part 1. Then the third and the fourth years are your clinical years of medical school. That's where you do your rotations, and that's where it was kind of solidified for me that I probably should stick with the goal of being a pediatrician. During those years, you spend about 8 to 12 weeks on different rotations, and that's where you get a taste of what the different specialties in medicine does. So I was able to do 8 weeks on pediatrics, and that solidified and confirmed that yes, this is absolutely where I want to be and where I felt most comfortable. But in addition to that, you also get to experience some of the other specialties just to see if maybe you might be interested in something else. There are a lot of people who come to medical school like me, feeling like they knew what they wanted to do. And then once they went on a different rotation, they realized, oh, I like this a little bit more. So going with an open mind and doing those rotations and kind of giving it all you have and trying to soak up all that you can from each of those experiences allows you to really see, what exactly do I want to do? Then there's another board exam that you have to take in order to graduate from medical school or to move on to your residency. That's USMLE board exam part 2. And then I got into my number 1 choice for residency in California and moved there for 3 years. Each of the different specialties in medicine have a different residency track or different length of residency. Pediatrics is one of the shorter ones. It's only 3 years, but some can be as long as 7 years. So residency is where you learn to become whatever specialty you're in. So if you decide you want to be a surgeon, you don't really learn much about surgery while you're in medical school or much about pediatrics while you're in medical school. It's really during your residency that you get to really delve into what that specialty actually entails. So I did that out in California. And then there's 2 more boards that you have to take before you can be completely done. Your USMLE board exam part 3, and then your pediatric specialty board. And then every specialty has their own specialty board that you would take once your residency training is over. And then I was done. So I don't know if you guys were adding that up, but that was 12 years, 12 years after high school in order to be able to fully call myself a full-fledged pediatrician. And on the surface, that sounds like a long time, but truly the time's going to pass anyway. And if it's something that you are passionate about and something that you want to do, you really will come to see that that time spent is worthwhile. So don't focus too much on that number. It sounds long, but it goes really fast. So what does a pediatrician do? Most of the times when people think about pediatrics or pediatricians, they picture a doctor's office, a 9 to 5 type of situation where they get their shots and their checkups, and they may go for minor injuries and those types of things. And that's largely what pediatrics is, or that's one aspect of what pediatrics is. But then there's another part of pediatrics where we do work that is a little bit more acute. We are still taking care of children, but we're taking care of children in the hospital, and that's what I do. I used to be a pediatrician in an outpatient setting, so in an office, typical 9 to 5, we would go in, we would do shots, do checkups, but then I kind of transitioned, and now I'm a pediatrician that works in a hospital, which is not, at your stage, that was not something I was at all familiar with. I didn't know that this was something I could do. So a pediatrician in the hospital, again, does quite a few things. We take care of patients that are a little bit more acutely ill. So here we have a little one. This is more than likely a cancer patient. He has something called a port, which is vascular access, so basically an IV that goes in directly into the heart, and that's able to provide medications, oftentimes antibiotics, sometimes chemotherapy drugs, sometimes for patients who need hydration or additional fluids. Then we also take care of babies in the hospital also. I don't do too much baby care now at where I currently work, but some pediatricians that work in hospitals, a large part of what they do is taking care of newborns and sick infants. Then we have another little one over here with a tube going down the nose, so likely has some issue where he's not able to feed adequately. And so that tube provides nutrition going directly into the nose and down to the stomach. And then we have another little one getting oxygen, probably an asthmatic patient, possibly a patient with pneumonia. So these are patients who typically can't really go home. They have some acute problem that needs to be managed or rectified before they can be safely sent home. And those are the patients that I get an opportunity to work with every day. One thing about peds, it is fun. Even though patients are sick, even though this is obviously a trying time in their family's lives, we do try to make pediatrics a little bit fun. That's one of the benefits, I think, or one of the things I really enjoy, that even though I'm doing something that is important and requires a lot of mental exercise and can sometimes be emotionally taxing, being able to work in an environment that is fun and brightly colored and has different amenities kind of helps to alleviate some of the burden. So this is probably Halloween. It looks like you see the pumpkin babies dressed up like Donald Duck. Yes, they do actually do this in hospitals where the nurses will make costumes for the patients in the hospital. And where I currently work, only at the pediatric hospital do they allow you to dress up for Halloween. They do not allow you to dress up at the adult hospital. So that gives us an opportunity to have a little bit more levity and a little bit more fun on our side of the building. Then one of the things that a lot of hospitals are having now is pet therapy for patients that are in the hospital. There's actually a dog that will come around and visit and just try to bring a little bit of lightness and fun to the children who happen to be hospitalized. So here in Huntsville, we have 2 dogs actually that the patients will sign up and the dog will come visit them for 30 minutes or so during the day. So I think a lot of these things seem to be for the patients, but they do actually help the staff out on a challenging day too. So my typical day actually starts at 5:30 p.m. I am something called a nocturnist. So I work only at night. I had mentioned earlier the flexibility of being in healthcare is that we're a 24-hour business. And so I am one of the doctors that works at night. So I usually wake up at about 5:30 in the afternoon and get ready for work, then get to work at around 7. And usually when I get to work, first thing I'll do is print a list of the patients that are on our team for the day. That could be anywhere from 5 patients to sometimes in the wintertime, 25 or 30 patients. And then I usually go see them. Sometimes I'll see all the patients, but most of the time I'll see our patients that are most acutely ill. So any patient that's on oxygen, any patient that, may be having dehydration issues or anything that I may have to adjust during the night. Or our patients, again, that are just a little bit more acutely ill, I'll certainly see those during the night. Then that might take me maybe about an hour or so, depending on how many patients we have. And then I do admissions. So I wait for calls from the emergency room. If there is a patient in the emergency room that they feel can't safely go home and needs to be admitted into the hospital, then that's when my team steps in. And part of what I do, I also work with residents and medical students from UAB and get a chance to do some education there and some mentorship and guidance for them as they're learning how to become a pediatrician. So typical day, what are some of the ailments and things that my patients could be dealing with? Medicine is very diverse, and so no 2 days are the same. No 2 patients are the same. So we may have a patient who's an asthma exacerbation who needs to come in. That's one of the common things that I tend to admit and take care of. And we have a vomiter or a patient with some diarrhea who's gotten significantly dehydrated, and so they have to come in for fluids. And this is a X-ray of a pneumonia. You see that over there. This patient more than likely has some respiratory distress, may need oxygen, and so can't go home. And then we may even have psychiatric patients who have overdosed, unfortunately, patients dealing with anxiety or aggression, different types of things, which again, they safely cannot go home, and so they have to be admitted into the hospital. Again, some of the other things that I may take care of are febrile neonates. So this is a procedure called a spinal tap, which typically we do on a baby who has a fever. And that can sometimes be kind of distressing to patients, kind of distressing to parents. Then we'll do a foreign body ingestion. So this little one has a coin that they swallow that's stuck in the esophagus there. Occasionally we'll deal with child abuse cases, which can be challenging to deal with, but again, having the opportunity to comfort and be present for a child and be instrumental in kind of removing them from a situation that obviously is not in their best interest is something that ultimately gets to be rewarding. So I'll admit patients like the ones you just saw. And then that is kind of typically how the night goes. I'll admit patients, or if there's an issue that comes up on the floor, then I'll try to attend to those as much as possible. Then during the nights, I do cover the newborn nursery. So if there's a problem with a baby that has recently been born, then typically I will get involved in those cases as well. But then around 6 o'clock, I check in with the nurses, make sure everybody did okay during the night, that there wasn't anything that happened that I wasn't aware of or that I should have been aware of. Then around 7 o'clock, I get to go home. And I usually do that 14 nights a month, so 2 weeks. And that sounds nice, but those 14 nights sounds like I'm only working 2 weeks. But those 14 nights actually can be quite tiring, and it is still a full-time job. Some people will do their 14 nights all in one stretch. Some people do 7 at a time, so they'll work for 1 week from Sunday to Saturday, and then they're off the next week, Sunday to Saturday, and then they rotate. My schedule is a little bit different, a little bit more flexible. So today I'm off, or tonight I'm off. I was off last night. So our schedule is not as stringent, but there are some places where you can do 7 nights, 14 nights, 3 nights. It just depends. So again, there's flexibility. Then the other part of what I get to do, so 14 nights a month, I'm in the hospital and working as a doctor, and then the other wonderful part of what I get to do is work as a mentor and an advisor. As we said before, I went to Oakwood University, which is a small HBCU here in Huntsville, and I just absolutely enjoyed my experience at that institution. And so once I was done, I decided to move back to this area to be able to give back to the school that I felt gave so much to me. And so now I kind of serve as their pre-med advisor, where I talk with students just like yourself who are a little bit further along. They are freshmen, sophomores in college who want to become physicians or want to go into healthcare in general. And so I kind of walk them through the process, guide them through the process of what they need to do at this stage. So this is me with some couple of the students from a class that I was presenting. We were probably talking about the medical college admissions test, the MCAT, or just talking about the timeline or the process of how to successfully get into medical school. And I think this is probably one of the best parts of what I get to do as a physician, just being able to give back and being able to encourage and provide something that I didn't necessarily have in terms of mentorship and advisement. So what does it take to become a pediatrician? A lot of the things that it would take to be successful truly in any field, but determination and perseverance are going to be very important. Being able to focus, right? Kind of knowing what you want and being laser focused on that and not allowing yourself to be distracted by the different things that will come along. Like I mentioned, this process is long, it's 12 years. And I can assure you that during that time, there were things that came along that attempted to pull me away from my focus. But you kind of have to be single-minded and know what it is that you want to do and stick with it. Then obviously love for children. If you don't really like children, probably shouldn't be a pediatrician. So love for children and just a desire to help this particular population. Then you need a little patience. Children can be, they're not always as reasonable as we would like them to be. So patience for the children and then patience also for the families is going to be very important and necessary. So if you're kind of hot-headed, pediatrics might not be the specialty for you. Then creativity, right? Working with kids, you kind of have to think of unique and different ways to do things, unique and different ways to get them to do what it is you need them to do. Kind of got to be a manipulator a little bit, trick them to do what you need them to do. Good communication skills is very important in any field, but certainly in medicine, especially pediatrics, as you are dealing with parents and trying to get them to understand your recommendations that you may be making for their children. And curiosity and being an investigator. I take care of patients that are from 0 hours old to 21 years old. Up until about 4, they can't really always articulate, and even beyond 4, they can't always articulate what it is they need, what they're having, what problem they're having. So you kind of have to be an investigator in terms of predicting or looking at tiny clues that they may be giving you to what may be going on with them in order to be able to help them as best as you can. So for your stage, kind of tips and tricks for success is the next thing we'll talk about. And I think one of the most important things is you have to strive to be better than average. Like you really can't settle for just being regular. One thing you'll see when you guys get to college is there are a lot of smart people there. You might feel like you're the smartest in your high school class now. You'll get to college, everybody there seems to be smart and well prepared, and it can kind of be a little intimidating, but you really have to continue to strive to be better than average. For medicine in particular, it is very competitive to get into medical school, very challenging to get into medical school. Only about 45% of people who apply to medical school get in the first time. And every year there's more people applying. I think last year about 52,000 people applied to medical school. And there aren't enough spots for everyone. So you really have to always try to be the best. Now, that doesn't mean you are what's the word? That doesn't mean you're undermining others, right? That doesn't mean you are vindictive. That doesn't mean you are in competition with others. I think being in competition with yourself, but again, you want to strive to be better than average. Then college is not like high school, right? I remember when I was in high school, I would do my papers the day before. Don't do this, but I'll do my papers the day before. I didn't really study. I did not study in college, in the high school. I can't really remember studying. And the thing that took me the most time was probably writing an essay for my English class. And then I got to college and realized college was a little bit different, a little bit different than high school in terms of what I needed to do in order to be successful. So the sooner you guys are able to grasp that, and hopefully before you enter college, the better. College is not like high school. It requires things out of you that you may not have had to do while you were in high school. Then choose your friends well. That is so important. I am a physician today, largely, or at least in part, to my roommate in college. She was more focused than I was, a little bit more dedicated than I was, even though I knew what I wanted to do, right? But I came and I met her and I realized, oh, she totally has a different handle on this situation than I do. And so she was going to all the meetings and she was doing all the things that I didn't necessarily feel I needed to do. And she would drag me along. So because I saw her doing those things, I said, okay, well, I'm going to go to this meeting. Or because she knew something was valuable and she was also wanting to go to medical school, she would tell me about it. And so when I say choose your friends well, you want to be around like-minded people. You want to be around people that are focused and are going in the direction that you want to go into. But some of that then will tend to respond, right? Then you want to develop good habits early, studying rather than cramming. Again, the days of me, studying the day before test or doing my assignment the day before test, you really can't do that in college. It's just not going to work at all. So developing those habits early. It's February now. You guys still have a couple months to maybe adjust some things before you're done with high school. But studying rather than cramming is a good habit to master now. Then getting enough sleep is going to be so essential. Again, didn't get enough sleep when I was in high school, came to college and realized the things that I was trying to do and stay up all night, those things were not going to be I wasn't going to be as successful at that as before. And then I stuck this in there because I hear this so often from my teenage patients about drinking water and minding your business. But what that means is just focusing, right? Worry about the things that are in front of you. And the only thing that's in front of you now is what it is that you want to do, what it is you want to be when you grow up. What are you working towards when you're going to college? Then talk the talk and then walk the walk, right? In my role as an advisor on a college campus, I meet a lot of students who say they want to go to medical school, right? And it sounds good. And I think people still think that being a physician is something prestigious and something, that sounds good and that they should strive for. But then I get a lot of people who aren't ready to walk the walk. So they say, I want to go to medical school, but they aren't doing the things that are consistent with someone who wants to go to medical school. So in order to be successful, I would say talk the talk and then walk the walk. If you want to go to medical school, there are things you're going to have to do. If you want to go to dental school or to be a physical therapist or an optometrist, there are things that you're actually going to have to do. You can't just say that that's what you want to do. So the proof should be in the pudding. Then be accountable for yourself, right? No one owes you anything. Again, that's something I encounter with the college students I work with. There is a disconnect between understanding what their role is in the process. You alone are responsible for your success. So if there's something that you want, go after it. If there's a question that you have about how to get from where you are in high school to whatever it is that your goal is, seek out the answers. We have the internet, there's YouTube, there's so many resources now that are available. There are mentors, there are programs like this that will allow you to get the answers to the questions that you want answered. Like no one should be able to say, I don't know what the process is to get into medical school. Like you can easily Google that, or you can seek someone out. You can ask an advisor, ask a high school counselor, someone, but the answers are there and you guys have to seek them out. It's not going to be enough to say, I didn't know, or no one told me, or I didn't have a doctor in my family, or nobody was there to guide me. You have to be focused on what it is you want to do and then find the answers. They are definitely out there. Then help someone, right? Excuse me. Yeah, help someone. And that does not have to be someone at your level. I got several students that I worked with at Oakwood that I mentored and advised. They are in medical school now in California, and they recently did a seminar for pre-med students just like yourself. So the things that they received, they have now gone to pass it on. So you really want to help others and try to bring somebody up with you. If there's something you felt like you needed or didn't have at your stage, then try to give that back. You guys are high school students. I'm sure that there are some elementary school students or middle school students who would love to hear from you guys about how to get to your stage or things that you wish you knew when you were at their stage. So definitely take any opportunity that exists or create some opportunities to reach back and help someone. And then be your biggest cheerleader. Along the way, there will be challenges, and there may be people who will downright discourage you from whatever it is that you're trying to do. But you have to kind of be your biggest cheerleader. Again, nobody owes you anything, so no one has to support you. No one has to encourage you. No one has to tell you what you need to do. No one owes you that. You have to be your own motivator and be your biggest cheerleader and just believe in yourself and what you're able to do and know that that your dreams are attainable. And some practical tips. Again, you guys are seniors, so you're probably looking at colleges and selecting which ones you're going to go to and trying to think about what your major is going to be. In order to be a physician, you do not have to be a biology major. I want to stress that. It's important that there are certain biology classes that you'll have to take, but you do not have to be a biology major in order to go to medical school or dental school. So do something that you like. Take some classes that are fun. Again, I was a Spanish major because that was something I enjoyed and I found fun. So if you like languages, then major in that language. You just have to make sure that your advisor knows what it is ultimately that you want to do. That way they can let you know what additional classes you have to take in order to be able to get into medical school. And then utilize your advisors. Again, you have to seek these people out. It's their job to help you. It's not necessarily their job to bring the information to you. You kind of have to go to them and they will impart whatever wisdom and knowledge that they have for you. And then have fun in college, right? I know I've been talking about all this serious stuff and being focused and choosing your friends well, but college is probably going to be one of the easiest times in your life. And so have fun in college, but do it in moderation, right? You may notice if your roommate is not a biology major or not planning to go to medical school, that their life is a little bit different. They may have a little bit more free time, but you can still, you can still have time to have some fun. So join some clubs, make friends, pledge if that's something that you want to do. But just understand that you can't do everything. College or medical schools are looking for well-rounded students. They want people who have done more than just studying, right? They want to see that you can handle the academic side, but that you have a personality, that you'll be able to communicate well and navigate well with patients, because that's just as important as being able to take care of them physically. So have some fun in college, but just not too much fun. You can't do it all. And then maintaining good grades. I kind of saved this for close to the end, but it kind of goes without saying, maintaining good grades. So what's considered a good grade in college? For biology majors who want to go to medical school, they look at your science GPA, so all the science classes you've taken and all the math classes you've taken. Typically, the average science GPA for students who get into medical school is pretty high. It's about a 3.6, 3.7. So what's a 3.6, 3.7? That's mostly A's and maybe a sparse B here or there. But so if you really want to strive for A's in your science and your math classes, that will really put you in a good position when it comes time to apply for medical school or even dental school. And then be careful what you put on social media. Social media was not as big of a deal or not as present when I was at your stage. We had AOL Messenger, which you guys probably have never heard of. But yeah, be careful what you do on social media. Those things can follow you in negative ways. And so if there's something that and then not just things that you post now, right? So the things you post now, you may think, oh, in 4 or 5 years, no one's going to be able to dig this up. Not true. So just begin to be careful now what you put out into the world and into the World Wide Web, because you may think it's gone, but it's not gone. You may think, your youth will cover you. It may in some instances, but it's just better to keep your social media presence as clean and boring as possible. Okay. And then, like I said, as I close, I think believing in yourself and following your dreams is really the biggest thing. Like everybody that you see who has achieved anything worthwhile, who has achieved anything great, it all started with a dream. And so I want you guys, during this weekend, really to think about what it is that you want to do. Like, what is your dream? Like I said, at 4, I knew what my dream was. Thankfully, I get to live that every day. But think about what your dream is. And it doesn't necessarily have to be a profession necessarily. You may not be able to pinpoint exactly what job you want to have. But if your dream is to serve people, kind of begin to explore in what capacity, how do I want to do that? But yeah, it all starts with a dream. And if there's anything that I can impart to you that you remember, that's the one thing I want y'all to focus on, is knowing what your dream is and just focus on it and let that dream drive you, and you'll eventually get to where you want to be. Are there any questions?
Thank you so much, Dr. Haughton. Students, if you have any questions, feel free to just type them in the chat, and then we can read them out. Let's see.
And if you could end the slideshow so that we're back on full screen and stop sharing.
How do I do? All right, there we go.
Excellent. Thank you.
We'll give a little bit of time just for students to just type out their questions if they have any.
While everyone's typing the questions, I'd just like to make a comment as well that you mentioned, getting ready for medical school. Getting ready for medical school starts now. So be mindful of what kind of volunteer activities you do, starting early. So for the admissions committee, they're going to look for longitudinal, meaning for a long period of time where you've done something for the community, volunteer activities. So start planning now. And as Dr. Haughton said, use advisors, use us. If we can help you, just let us know. And, we can tell you what kind of activities will be beneficial to you. So just bear that in mind. If you really want to do this, you need to start now.
Yes, that's really important. Like Dr. Carmel said, it's very, very, very important to get involved and do things. Again, focusing on helping others. If whatever activity you're doing is helping, that'll be beneficial to you when it comes time to applying for medical school. Does anybody know what their dream is? Let's see, there's a question.
So I just popped into, oh, the questions are starting to come in. But before you start asking and answering questions, I just dropped in the chat a link to a Google Doc. If everyone would log into that Google Doc for me and fill in your information so that we can keep tabs of the attendance on these presentations. Thank you.
All right, so I see a question. What were some specifics I looked for in a medical school? That's a great question. Typically, location is one of the things that I was focused on. Again, I'm Jamaican. I don't do well with cold weather. So I knew there was a part of the United States I did not want to be in, even though I still kind of ended up somewhere that gets a little bit of snow, but I knew the Northeast was not going to be an option for me. So for me, location was important. Proximity to family was important to me. And then I knew I wanted to be a pediatrician, so I wanted to be at a place that was connected to a very good children's hospital. And so I got those things at the University of Cincinnati College of Medicine. I'm not sure if anybody knows about Cincinnati, but that is usually either the #1, 2, or 3 children's hospital in the country on any given year. And so being able to be exposed to that as a medical student really gave me good training for wherever I ended up going to residency. Then it wasn't too cold, the weather wasn't too bad there, and then it was somewhat close to family being in the Midwest. So those were the things I looked for. Other things you can look for when you're trying to select a medical school is how they learn. So some programs have something called PBL, which is problem-based learning, which works for some people. They tend to work in small groups. You're in these cohorts of about 6 to 8 students, and you follow with those students for about 2 years during the first and second year of medical school. I am a more traditional learner, and so I knew I wanted a school that had a lecture-based curriculum that was similar to college, where we sat in a lecture hall with 165 other students, and it was, you know, like a traditional didactic session as opposed to problem-based learning. I knew that PBL would not work for me. So that was one of the things I also looked at when I was trying to decide which school to go to. How often do I handle emergencies? Great question. I don't handle emergencies too often. So I work at Huntsville Hospital. I do not work in the emergency room. There's a specialty of physicians that work in the ER. There's pediatric emergency medicine doctors. And so usually they will tend to deal with the emergency sooner than I do because the patients come directly into the emergency room. Once they stabilize the patient and decide they need to be admitted and they can't go home, that's when I tend to get involved. Emergencies do happen on the floor. Definitely had to, unfortunately, run codes on the floor. That's typically when a patient has gone into cardiac arrest of some sort. But in pediatrics, thankfully, it does not happen as often as it does in adult medicine. But yes, from time to time, I do need to handle emergency situations with my patients. How long have I been practicing medicine? So I've been a physician for 10 years. This will be year 11. What steps did I have to take and how long do a typical checkup last? So again, I work in the hospital now, but when I worked in the outpatient setting, a typical checkup, it should take probably 30 minutes. However, you tend to get a little bit shorter time to do that. So probably about 20 minutes, but the visit can, if you've ever been in a pediatric office, depending on what they present with or depending on what additional questions parents may have, a visit could easily be an hour if you're dealing with a mom that may be new or having a patient with an acute problem. So, but typically about 30 minutes. What does it take to have your own private practice? Great question. Some business knowledge is going to be important. Then being able to get a loan in order to get a building and just kind of some business savvy and some business sense. But it truly, that's an option for some physicians. That's not something that I had wanted to do or had been a dream of mine. But yes, it is an option to own a private practice, and it's a rewarding experience if you are inclined in that way. Okay, all you need is a building, some marketing, and a business manager.
Money.
Huh?
Lots of money.
Right, and a loan. Yeah, you probably need a loan to start with, but it's definitely possible. Tons of people feel like that's a better option for them than working for a group, and so if that's your goal to own your own practice, it is absolutely doable. I think that might be it.
So another, if I can also add that if you are interested in medicine and even not necessarily pediatrics, any aspect of medicine, start looking for opportunities to shadow doctors. So right now there's some restrictions because of COVID, but when things start to go back to normal, having those experiences, because when you go in there and see what the job actually entails, it may be different than what you think it entails. And so you may want to go a different route, or it may enforce your desire. So find those opportunities. If you like pediatrics, ask your own pediatrician if they'll allow you to shadow. I think another question came in, sorry.
Yes. Is your residency considered school years or is it paid? Both, which is good. So in medical school, you typically can't work. I made the mistake of trying to work through medical school, and I soon found that was not a good idea. So it can be challenging to work during medical school, and I do not encourage that at all. Most medical students end up taking out loans, and part of your loan package involves actually living expenses. So you aren't, going to be starving. You'll have a little bit of money to be able to feed yourself while you're a medical student. But then when you go into residency, you're actually paid during that time. Excuse me, you're actually paid during that time, but you're still learning how to become a pediatrician or a surgeon or an obstetrician, whatever specialty you're going into. But yes, medical or residency is paid during those 3 to 7 years. And the pay kind of goes up as you go along, as you advance. How can I choose where to do my residency? Another good question. Again, for me, location. So the same kind of idea. Location, proximity to family is going to be really important because it's challenging, right? So sometimes you want to be able to get a home cooked meal. Sometimes you want to be able to sleep in a comfy bed. Sometimes you just want, a family member to love on you and take care of you because you've been stressed from working 80 hours a week as a resident, which is typically what residents tend to work. And most people work about 40 hours a week. A resident is probably doing about 80, depending on the specialty. There are regulations now that prevent your program from having you work longer than that, but it is not always honored, unfortunately. But yes, so residency can be very challenging. So I chose a place where I had support. I was out in California. I do not have family there, but the residency program I chose is very nurturing. And there were quite a few people that I had known that ended up doing that program or had gone there before. So I had somewhat of a support system there. Then in terms of where else, you want to choose a place where you'll get good training, right? So if you are a surgeon or wanting to become a surgeon, then you choose a place that has a good reputation or has some surgeons that you are highly respected in the field. But again, most programs tend to be, they have to be accredited. So they're all fairly good in terms of their quality. What are the typical job benefits? Raphael, can you expound on that one a little bit? Like when you say, what are the benefits? So as a resident, I'll try to answer, but in case this doesn't answer the question, go ahead and clarify that for me for a little bit. As a resident, you get health insurance. As a resident, you get days off. You get paid time off, not very much. I think 2 to 3 weeks a year is typically what we had in terms of paid days off. Yeah, in terms of paid days off. But yeah, you get paid as a resident and you get health insurance. That's pretty much all you get. That's pretty much all they give you. Yes, you do get health insurance. Your health insurance, dental insurance, those types of things. They do try to take care of you because they want you to finish your training and they want you to be available to help them take care of patients. So
If I can also add another comment as well. So before the question was about choosing where to go to school. So cost, something you're going to see when you're starting to apply for college. In-state and out-of-state are two entirely different things. Now you might get scholarships, but you want to bear that in mind. It's twice as much to go out of state as in-state. So just have that in the back of your mind when you start thinking about schools.
And I will say this also, especially for pediatrics, right? So most people at your stage, or most young people at your stage, they think all doctors are created equal in terms of pay, right? So most people hear, oh, physician, and they automatically think all doctors are rich and they have all this money. Well, not all specialties get paid the same way. All doctors are rich in that we have this wonderful opportunity to take care of patients. And that's where our wealth comes from. But yeah, not all specialties necessarily are these wealthy physicians that you tend to envision or imagine. And so if, in a real practical sense, if you're considering primary care, if you know that you want to be a pediatrician, if you know that you want to work in an office in a community setting, you kind of have to think now about finances. And I know at your age, you guys aren't paying mortgages and bills and those types of things, so it's hard to imagine, but just know that you want to be able to get medical school paid for if you are planning to go into a specialty that may not necessarily be as lucrative as some others are. So in general, everybody, you want to try, and like I tell my students all the time, you're not just trying to get into medical school. You're not just trying to get into dental school. You're trying to get someone to pay you to go there. There definitely are scholarships, however, not as many. And one of the ways you are able to compete for those is, like I said, don't be regular, don't be ordinary, be the student who's at the top of your class. And those opportunities come a little bit easier. There aren't as many opportunities, but you want to try to avoid taking out loans as much as possible. So even at your stage, you want to begin to Google and explore and look up how to pay for medical school without loans. If you Google that now, you'll have plenty to see, and that'll give you an opportunity to kind of see what other opportunities are out there. There is military service. So if you join the military, they'll pay for medical school and pay for dental school in exchange for some service, right? There's nothing in life that's free. But for some people, that's a valuable experience and they feel like it's worth it. There are opportunities where you can work in underserved areas or commit to work in an underserved area once you're done training, and they will cover some of your loans that way. But if you are considering working in primary care, which is pediatrics, family medicine, internal medicine, if those are the specialties you're leaning towards, basically anything non-surgical, you want to explore options for how to pay for it. Medical school is very expensive, like along the order of about $200,000 a year. And so that's not something to be taken lightly. So if that's something you want to do, definitely begin to look at, how am I going to pay for this? Now, don't let that discourage you, right? Don't let the cost of medical school deter you from going into medicine. As I'm sure you all well know, there aren't very many African Americans, men, women of any kind, in medicine. Only about 5% of physicians in this country are Black. And so don't let the cost deter you. Don't let anything deter you, but just be aware of what the challenges are and think of and come up with ways to kind of navigate around those challenges and still keep that as your goal. Yep, that's it.
I can add to that comment as well. Even though the percentages right now are low, there's an active movement to try and improve those numbers. So don't let just because there's 5% deter you. There's an active, we're as a school at UAB and around the country, there's an active movement right now to level the playing field for underrepresented in medicine. So just take that and bear that in mind. Things will get better.
Yes, absolutely. And then you guys can be a part of things getting better, right? As you all enter into healthcare, that those numbers go up. And so if you can just stay focused, if this is your goal, Just think of the impact you'll have an opportunity to have. How much money do I need for college and medical school? A lot. I don't know how much college is these days. How much is college? When I was a student, it was $15,000 a year to go to Oakwood University, just about. That was about 20 years ago. So I think it's probably a little bit more now. But again, same concept, just like I talked about for medical school. Your goal is to try and get somebody to pay for your education. And so being competitive and getting good grades and applying for different scholarships that may be available is going to be helpful. But I would, for medical school, about $200,000 is a fair estimate as to how much it will cost. Like Dr. Bevensey mentioned, you want to pay attention to state schools versus out-of-state schools, private schools versus public schools in terms of medical school, and even colleges and universities is going to be important as you're trying to decide which school to go to. You have to look at the cost. That's going to be important too, because the loans don't go away. All right, Karis Thomas says, what are some advantages and disadvantages of medicine, or?
Thing of working in the medical field.
Okay, some advantages. I can't really think of any. Well, I can think of some disadvantages. Advantages of working in the medical field. One, like I said, I get to do the one job I've wanted to do my whole life. Like I that will always be impactful to me. Like I will be at work at 8 o'clock at night. I walk into a room, I see a patient, and as I walk out, it hits me. You are doing the one job you've wanted to do your whole entire life. I mean, even now, 10 years in, that still is jarring to me. That still is something that I appreciate. So I think that's one of the advantages of working in medicine. Then I get the opportunity to really support and be with families when they're most vulnerable, right? If you have a child that's sick, that is a very stressful time, whether or not it is a major illness or something that is not as severe, but you want your child well, right? And so to be able to be present and serve a family in that capacity is rewarding. Like I work at night, I get home late, I get home early in the morning, I'm tired, I'm exhausted, but I feel good knowing that I did something good for several somebodies in that 12-hour night shift. Some of the advantages, job security, like I said, physicians will always have an opportunity for employment. And then some advantages, I do get paid decently well for what it is that I do. So that supports the lifestyle that I have. Then disadvantages, we talked about the 12-year process, right? And so during those 12 years, there were things I did miss out on. You don't have to miss out on everything, but you will miss out on some things. And so when my peers and my colleagues were working and able to save a little bit of money and do investments and those types of things, when they had finished college, I wasn't able to do that because I was in medical school and had no money. So that's probably one of the disadvantages, I would think, but honestly, I don't really view that as a disadvantage. It's just delay of gratification. Eventually my time came and we were just on different paths. So in terms of disadvantages to healthcare, I honestly can't think of any. You do miss out on some of your social life because you do spend your 30s, 20s and your 30s, early 30s, kind of focused and locked away studying and spend a lot of time in the hospital. But there's still time to do things. I mean, I know people in medical school that got married or people that had children. So you really are able to live whatever life it is that you want during that time. You just kind of have to keep all the balls in the air. And it's only for a short period of time. It's not forever.
All right. Thank you, Dr. Haughton. I think we're going to end questions there. If students, if you have any burning questions, feel free to email us. We'll drop some emails in the chat. Also, if you haven't already, make sure to go and put your attendance on the Google Doc we have posted in this chat. And then lastly, we talked a lot about doing well in school. And so if you are struggling, we have a free tutoring program that we have set up for virtual tutoring. And so if you need any help, your teacher should have the link for that, or you can email us directly for the link.
Or you could add in on that Google Doc that you're interested in tutoring, Jean-Paul, if that's okay.
Absolutely.
You could add in on the Google Doc that you're interested in someone tutoring. And if you could give a little information as to in which area your tutoring is needed, that would be helpful so that we can have you connected with the right person.
And just again, to reiterate, it is free and they will work with you when it's best convenient time too. So if you're in any need or have friends who have a need for a tutor, please let us know. Everybody that's doing this is background checked, so there's no issues with that. So they're all set and raring to go and excited to do it. So please use that service.
And I've put my email in the chat as well. So if you want to reach out to me and have any questions for Dr. Haughton as well, and I can get them to her and get them answered for you.
Absolutely. Thank you all for having me. It was a pleasure talking to you guys. And like Jean-Paul said, I'm available. So send any questions that you may have about pediatrics or medicine in general. Happy to answer them. Thanks, Jean-Paul, for the invitation.
Thanks, Dr. Haughton.
You're welcome. You all take care.
And thank you, students, for attending.